Welcome, everyone, to the Beauty and the Surgeon podcast. I'm Amy. I'm a nutritional therapy counselor, and I'm here with the Face First Beautiful Dr. Jason Martin, MD.
So, Amy, we're going to talk about my beauty. All right, that's going to definitely be part
Your
of this podcast.
Your beautiful face, specifically.
But we got to give a shout out to America, right? It's almost the 4th.
Yes.
You and I are very patriotic, and we thought that we would talk about beauty today, specifically what makes a face beautiful, but what makes America beautiful? What is beauty in America? And we can start with my beauty, that's fine, but we need to make sure we capture all of America.
There are so many things that make America beautiful. Like as you said, I am patriotic, and I have a very strong love for being a woman in this country specifically. To me, the thing that makes America beautiful is that I have freedom as a woman. That is the thing to me that I appreciate the most.
What makes America beautiful to me is we have public schools that we can send the kids to so we can have alone time during the day.
You like the public school system?
Yeah, the public school system. No. So today we're talking about what makes a face beautiful. And it's kind of a trite title, but basically we're talking about beauty.
And facial aesthetics.
Mm-hmm. And people always ask us, like, how do you decide this? What looks good? What doesn't look good? And that's
what do you think?
What do you think? We're going to talk about that today. This is such an interesting podcast. You could have a whole podcast series about facial beauty, I think, because it's culturally driven. It's driven, and it's individually driven. What some people find beautiful and other people don't. It's dependent on people's mindsets and their background and their experiences.
I'm going to say it's dependent on your epigenetics and what your grandparents ate.
Amy's going to say it's dependent on our DNA and we have no control over it, which is a typical Amy comment. But
we have all the control.
There's many different components to beauty. So on this almost celebration of America, I think that we wanted to pick a topic that's fun and also celebrates the diversity that's out there in our country, but mostly the diversity that comes in our office. Mm-hmm. Because I can tell you, there's people that come in our office that maybe aren't visually beautiful, but they are just beautiful people. When you see them and you meet them, there's some energy or glow, and I'm not down with that whole program, but Amy is. And they are just beautiful people. There's other people that come in that literally are strikingly beautiful, but maybe they're not beautiful.
Right.
And so there's a gestalt there, and I'm not really sure how to describe that. I'm supposed to be the expert on beauty, but we're going to kind of parse this out today. Right, Aim?
We are. Starting with the golden ratio.
Why don't you tell us about the golden ratio? Because I tried to describe this to my kids and I totally failed.
Oh, really? I mean, I guess on a really basic level, it's kind of an algorithm or a...
It's a ratio.
Yeah.
It's a ratio of numbers that you find in nature and you can find in human anatomy and architecture.
In some facial symmetries, yeah, and other things.
So it's a ratio that is the same as the ratio. So a golden ratio, if there is a ratio that is the same as the ratio of their sum to the larger of the two, meaning that if you have A and B over A plus B, then the ratio of A to B is the same as the ratio, and A is the larger number, the ratio of A plus B to A. So forget about all that kind of stuff. It makes an irrational number. And irrational numbers are the numbers that the decimals go on forever. So what's another example of an irrational number, Amy?
Pi.
So that goes on forever. We all remember that. 3.14.
3.14. Nils is laughing because he knows.
Does you know it, Nils? Your dad was an engineer.
I'm like, when is Pi Day? Sometime in March.
3.14, and then you got to say 6555 447.
9 8
just
2
pull it off.
0
Yeah.
1.
I remember there was somebody I knew in medical school that had memorized it to like the 15th decimal point. Anyways,
I bet they were a lot of fun at parties.
Totally fun. Hung out with that dude. This is a rational number, and that has historical significance because over time. Even in Greek times, there was Pythagoras used this, and Euclid and Kepler in the Renaissance. If you know anything about history, Kepler was an amazing mathematician. And even this guy, Roger Penrose, now they kind of go back to this ratio, this number, which is basically a number 1.618. Just follow it that way. This Robert Penrose guy actually had worked with, who's that famous physicist that had ALS? Just died. The one who... Stephen Hawking, yeah, thank you. He is the one who kind of came up with a singularity. This guy is legit. So all these people have this number has been repeated, and these ratios have been repeated in nature, in science. And so they put significance on that, and people have attributed beauty to these ratios. So these triangles with the ratios of 1.68 or the rectangles, and we'll get to that. I don't know if this is totally off the beaten path, but when you look at beauty and you actually look it up, there's a lot of information on the golden ratio. And this has been throughout history of man that this ratio comes up. If you look on our YouTube channel, Jason Martin MD, you can see the ratio, and we can skip over that. But everyone knows the nautilus, right? And that has that golden ratio to it. So if you look on our YouTube channel, the square that's 5 by 5 goes to 8 by 8, that goes to 13 by 13 and 21 by 21. So if you add the previous two numbers together, it goes to the next square and to the next square, and that goes out like a nautilus. And that is repeated in nature. You see that. So you can imagine that there's certain facial features that have these ratios like this, almost this Fibonacci spiral ratio that makes a face look more perfect than maybe another person, right? Am I way off track?
No.
Okay, you follow me?
I'm following.
Nils, are you good with that? Good. So, and then you look at people's faces, and then you start dissecting what makes faces beautiful. Well, is it the nose to eyebrow length is almost a perfect triangle, or there's a perfect triangle between the midline of the nose to the outside of the eye. Sorry, not triangle, rectangle. Or there's a perfect rectangle from the mid-nose to the chin. You start seeing these ratios in these facial dimensions, and then you start saying, well, maybe there's something there, right? What do you think so far?
Yeah, I think that's true. I think as people, we do like patterns, essentially. People kind of like to see patterns in things, in nature and people. Again, what the perfect ratio of these things is, though, is not 100% the same.
Yeah, we're going to get to that. I mean, so I'm kind of leading you down a path to kind of pull the rug out. So clearly, if you look at facial aesthetics, it does relate to proportions. If you have a person with a nose that's 3 times the normal length, you're going to look at that person and say, wow, that's a long nose. You know, you're not going to say that's the most beautiful person I ever have seen, even if their eyes are beautiful or, you know, their eyebrows are perfectly placed.
Because you're so distracted by one thing.
Right. Proportionality does play a big part, but it doesn't play everything. And we'll get to that because there are people, specifically people that are quote unquote beautiful, that really don't have great proportionality on their face. There are other people, and you've mentioned it, we were talking about it beforehand, like a Brad Pitt kind of person or a George Clooney, who have that kind of perfect proportionality. Maybe not Brad Pitt, but George Clooney definitely does. So the golden ratio, historically, people have said, you know, this could maybe be the answer to facial beauty, but it's not just that. Also, there are certain aspects through time, and again, on our YouTube channel, you can see there's a slide from the 30s that showed pure beauty. And it's really so interesting. Like they broke down the face into the length of the nose. So the nose, if the forehead was the length of the nose, and then from the bottom of the nose to the chin was the length of a nose, then you had a perfect face that way. And then they used the nose length and put it around to the cheek width and stuff like that. The lips had to be equally spaced horizontally, stuff like that. So interesting, like what people find beautiful and not. And that has changed over time.
Oh, so much. Yeah.
I mean, I would argue actually that the forehead is even longer now. That the idea of beauty deals with longer foreheads and even shorter chins.
Well, and a much narrower face overall.
And a narrower face overall and more angular.
A little bit closer set eyes.
Yeah. But the problem with all this stuff is when you get into these ratios and looking at things beautifully, again, you have to look at our YouTube channel. I'm sorry, we keep referencing that. So there was this plastic surgeon, I'm not calling him douchebag, in 2012, I'm going to get in trouble for that, who came out and said that, you know, he decided that he's going to find the most beautiful person in the world using the golden ratio, and he found Amber Heard. You know, who is Amber Heard? She's an actress, right?
I guess.
Johnny Depp's wife or something? Come on, Nils.
Oh, yeah.
Who's ever listening to this should be
all,
like, are you kidding me,
We are
guys?
so into pop culture in this room. I would ask you actually.
All right. Well, so this is say she was married to Johnny Depp and they had a terrible divorce. And why I don't know why I know that.
Is he married to? Isn't he married to the British woman who always?
That's
looks,
Amber Heard, right?
No. She looks like a bag lady most of the time.
No. That's a different lady. I know who you're talking about. Yeah, I know who that is. She's the one who's always a weird character in movies,
yes,
like a witch or.
Also looks weird in real
Yeah,
life.
she's okay. Yeah, but she's someone who's beautiful and maybe has different proportions. Right. Anyways, if you look on our YouTube channel, he applied this Fibonacci spiral to her face, and he decided that she had perfect proportions. But then there's this there's this Twitter account, Fibonacci Spiral, at Fibonacci Spiral, FIBONACCI Spiral, which applies the spiral to different body parts, and they have this man on there with a beard, and his pot belly fits perfectly into those proportions. So.
Well, there's beauty in nature.
I'm thinking that maybe this is not beautiful. All right. So for us, Amy, so we look at beauty in a way that's a little bit different. So we'll get into like at the end of this, like what true beauty is. But for us, we try to use things that are analytical, right?
Yeah, and definitely from a reconstructive standpoint, when you're wanting to reconstruct a face, you kind of have to have some markers like bony landmarks, other things that you kind of can identify and
right.
Make adjustments from there.
So when I'm doing facial trauma or facial reconstruction, I tend to use some of these bony landmarks, and maybe not from an x-ray standpoint, but there's something called cephalometric analysis.
Common spelling.
Yeah, common spelling, again, that uses the bony landmarks and as they relate to your soft tissue. And that's where, if you ever have seen an oral maxillofacial surgeon or someone like me who's a reconstructive facial trauma surgeon, we'll use some of these landmarks to help us reconstruct your face to make you look normal or to bring back your beauty after traumatic injury.
And that's bringing back the symmetry to the face. I mean, I think of instances where we've had trauma patients who've had like severe trauma, specifically like to the lower angle of the jaw, like out where your lower jaw is closest to your ear, and where it's been broken into so many pieces. There has to be something that you kind of go with to make sure that angle is correct again, and that's where you end up using some of these other bony landmarks of the other parts of the face and looking at them, because obviously if you got to be able to chew, so you want that to line up as perfectly as possible to the other side.
So if you see someone's jawbone is off, or their cheekbone or their orbit slightly off, then that's going to take away from quote unquote their beauty and make them look asymmetric and different and not normal.
Yeah, especially if one is like depth perception wise a little bit back.
Yeah, that's called inophthalmos. You're talking about the globe. Yeah, you can definitely see that.
Really see that in somebody. And, a layperson looking at them might not know why, but like, whoa, that looks weird.
It looks weird, yeah. So we use cephalometric analysis. We use CAT scan through reconstruction. We just had a recent case that was awesome. Unfortunate circumstance, someone was injured to the face, pretty bad injuries. Got a CAT scan of their face and looked at all their facial bones. And don't get me wrong, they had a lot of soft tissue problems too, skin and soft tissue. And we digitally reconstructed their face before we even did surgery on them. Then 3D printed out a splint for their teeth to line up their teeth correctly, so a 3D printer. And then pre-bent, or we had reconstruction plates that were bent by the digital plan, and then did surgery on the patient, and it was amazing. So we were able to restore her beauty, all the parts that were good, and kind of bring back what was there, even though it was disrupted. Which
pretty amazing.
It was amazing surgery. With that said, it is weird because digitally enhancing or reconstructing someone's face, theoretically speaking, you could digitally enhance their face. You could make their bite even better than it was before. If their cheekbones are broken, you could bring them out a little further to get it. So we're not doing that with
narrow that jaw a little.
We're not doing that with reconstruction, partly because of what we're going to get to is that beauty really is an individual thing. And we try to honor that per each person. But most of beauty relates to these proportions, and then those proportions are created by the bony structure that are then reinforced with the soft tissue and the skin on the outside and the muscles. So beauty has an anatomical derivation, right? So that's the answer. The anatomy, right?
Not entirely.
Okay. And that's what we get to. There's a guy, Potter Stewart. He was a famous judge,
Supreme Court Justice.
Supreme Court Justice. And since this is the episode to honor America, so we're talking about the Supreme Court Justice. And by the way, if you ever go look old Supreme Court justices, they all look the same. Like literally, you could take their picture. It's nice now to have some diversity on the Supreme Court, because the old days they were always like 60-year-old dudes with a receding hairline, Caucasian. So there was a famous case, and you should actually look this up. It was Jacob Bellis versus Ohio. And Ohio, I guess, was like suing Jacob Bellis. I'm not sure, because he had made some movie or some video, and they thought it was pornography. And he said it wasn't. And it went all the way to the Supreme Court. And basically what Judge Potter said is that it wasn't pornography, but he could never succeed in intelligibly telling you so, but I know it when I see it. And that's a famous saying, like, I know it when I see it, right?
It's like a meme or like a...
Yeah.
Yeah.
And that's beauty.
Salt Bay.
This is beauty. Like, you know it when you see it. It is something almost mystical. And I know it's crazy I'm saying this, because I'm a guy who's a cosmetic surgeon who operates on patients' faces all the time. And I know it's based on the anatomy. And I know that everything I do makes people look, quote unquote, more beautiful, hopefully. I mean, that's our plan. Mm-hmm. But it is kind of, I know it when you see it, you know?
Yeah.
And that's why some people don't fit the ratios. Some people have weird bone structure. And if I tried to digitally enhance their face and make them look like what we consider the normal beauty, it would distort them and they wouldn't even look beautiful anymore.
Right. If you're just trying to face tune everybody in real life.
Right.
Yes.
So maybe Judge Stewart, was onto something.
I think he was.
And that gets to
perception.
So if you look again on our YouTube channel, we have, what's his name?
Owen Wilson?
Owen Wilson. He's a pretty good looking guy.
No.
He has terrible teeth.
He is a weird looking dude.
His nose is messed up.
He is so strange looking.
We also have Adam Driver, who was in Girls, which is a great show on HBO. You should watch it. He was also in Star Wars. Amy loves Star Wars.
To me, I've never seen Girls, so I just look at him and see a villain.
She's never seen Star Wars either. Who hasn't? What American
hasn't seen Star Wars?
I
spent my entire childhood. My entire childhood was spent dressed up as Princess Leia.
What does she watch? She doesn't even watch Harry Potter.
All I watch is Star Wars. Okay. I am Princess Leia.
No, not the new ones. The new ones.
Oh no, I've seen the new ones too.
Okay.
Not the newest new ones, like the Jedi ones, but oh yeah. No, I'm like.
All right, so Adam Driver was Darth Vader character.
Yeah, so he's a villain.
Yeah.
Villain and a weirdo.
I consider him a good-looking dude, but like his nose is way too long. He's got an underdeveloped jawline and then a prominent
his
chin.
Ears. Oh, and his ears.
Yeah.
Mm-hmm.
But
that's why he became Darth Vader.
But like on Girls, he was portrayed as like a really handsome dude.
Really?
Like maybe not totally smart, but like very handsome, nice physique, good face. Like, oh, he's really good looking.
He's got broad shoulders, but see that also, like, his head looks way too small for the size of his shoulders.
Yeah. So I feel bad that we're critiquing Adam Driver, but he's a rich actor, so he can handle it, right? All right, he'll do okay.
He'll be okay.
So this kind of gets down to it. What makes a face beautiful? It can just be this gestalt. You got to have the right proportions. You gotta have good soft tissue, and it's better to be more young, basically. But there's some people, that we see that are older that are absolutely drop dead beautiful, with gray hair and wrinkly skin. So that's not a number one priority. You have to have. I think even if you have asymmetries, and there's something called hemifacial microsomia, we see it a lot where one side of the face is not developed, and it's really interesting. People come in, it's really subtle, and they'll say, I just feel like my face is a little bit off. And I'm like, yeah, because half your face is less developed than your other half. And they're like, what are you talking about? I'm like, just see how your teeth don't line up perfectly. You can tell them these few things. And they're like, oh my God, I've been like this my entire life. I mean, yeah, you were born this way, but you look great. The soft tissue makes a difference. Skin coloration, eye color, eyebrow shape. We have a great episode we did recently on brow lifts. That shows you where it is. And then obviously the other things that go along with that, which is the volume of the face, which is like the fat and where it goes. FYI, most of us consider babies and children fairly beautiful, right?
Oh, yeah.
I mean, it's because they have cherubic
Yeah.
faces.
Perfect skin.
Yeah. But then what do people do? Because big round faces are beautiful. What do? They take these fillers and they go to some middle of the road doctor, and the doctor over injects their face, and they look like weirdos.
Mm-hmm.
So
because it messes up the proportions.
right. And if you're 60
Yeah.
and you have a big round face and you're not culturally Asian or someone who has round faces, then you're going to look like weird.
Well, and skin is kind of like it's a tent, and the muscles or the the bones are kind of the tent stakes.
Yeah.
You start messing with one side of a tent, you can see that on every side of it.
Right.
So your face is kind of the same way, especially if there's laxity on your skin at a certain point. You start messing with something, the effect is going to appear on your entire face. Like your entire facial aesthetic will change, even if you're just kind of changing one thing.
Yeah, and I think that just a side point, and we talked about this many times before. We had a great episode on facelifts, or it was a long time ago, but we talked about balance. You know, beauty is in balance no matter what. Sans Adam Driver and one of the Wilson brothers. But, I think that in most cases beauty is in balance, so you don't want to over-inject your cheeks and have an underdeveloped chin or something like that.
Mm-hmm.
All right, so we recognize the fact that it's kind of a gestalt, that there is no definition. And then, Amy, so from when we look at people and we want to help them, we want to make them feel more beautiful in the face, what do we look at specifically?
I mean, we're looking at kind of how things have maybe changed over time.
Right.
We're looking at putting things maybe back in a position that is more youthful, still age appropriate, kind of helping to rebuild what's been lost a little bit. And there's something we didn't bring up too that affects this is something that dentists do a lot of, is adjusting the bite, and also kind of adjusting as things break down as we age, like losing a little bit of bone here and there. Those are the really deep things. So what can we do with the bone structure that you have to kind of bring things back up?
Exactly. So we look at all the layers: skin, subcutaneous, which is like basically the fat, and then the SMAS layer, the musculoaponeurotic layer, and that's the muscle layer that we tighten with a facelift. The retaining ligaments, that's the areas that hold the skin down, and then the other fat and loose skin kind of folds around it. And then the bone and the deep fascia. Mm-hmm. And to be honest with you, I would argue, as a cosmetic surgeon that does a lot of face and neck lifts, a big part of beauty comes with skeletal structure. Mm-hmm. And that's why when you get older, your smile changes a lot. It's really because your bones, you have osteoporosis, your teeth change and shift. That's why a cosmetic dentist or people that deal with this stuff are actually really important for beauty, mm-hmm. To maintain it and to actually enhance yourself. And people lose track of that. But the same is true on your cheekbones, on your jawbone. You can just see the loss of bone volume or structure over time.
Well, we've talked about this in our episode about rhinoplasty. People think their noses are growing as they age, but it's really just they're relaxing almost, like those ligaments that hold everything in place are letting the nose kind of pull down and fall a little, so it kind of has that more widened, heavy appearance, like bottom heavy. Your nose bottoms out.
I know you're right with that, but I'm so convinced that some guys' noses actually grow.
I mean, it does.
Because you see them 10 years later, and you're like, dude, you have the largest damn. And I think it's because their skin gets phimotic. Oily and glabrous and
thick. Yeah. Now, people who have like actual medical conditions that cause extreme thickening of that skin, yes, they probably do.
So I know the truth, but
grow.
You're still looking at them, and you're like, that nose is growing. And ears are the same.
Pinocchio.
At some point, the ears have to stop growing, right?
Yes, they do.
Okay.
Yes. We've talked in our otoplasty episode, we talked about how ears pretty much are developed by the time you're 8.
Yeah, 8 years old. We look at things anatomically speaking, but if you think about what Amy and I do, I also look at people with a gestalt. Mm-hmm. So the reason we brought up the golden ratio at first, people want to come in and get 3D scanned and then let us fit the perfect mean of beauty, and it doesn't exist. So I say over and over with cosmetic surgery that this idea that these doctors are artists are kind of a joke, right? Mm-hmm. It's kind of a marketing tool, but there is a truth to that. I look at people as an art project, and I want to enhance things they already have and make them look a little bit better, but I'm looking at them through the prism of a person from America, who's grown up in this culture, and I have an idea what beauty is. Mm-hmm. And most people that come in my office have the same idea, right? Sometimes it's a little bit distorted. Sometimes maybe I'm conservative and they want to push it, or vice versa, to try to enhance what's there. But what makes a face beautiful really is the gestalt of all these different things.
And that's why we've said it many times on our podcast, when you're looking for a plastic surgeon, it's important that you feel like you do see eye to eye with them about their aesthetic. Because, that it matters. You don't want someone to make you look how they think you should look if you want to look like yourself. So those are good conversations to have. And that is a thing. I mean, there are definitely surgeons who years and years ago were kind of accused, is maybe not the right word, but had a very definite style of surgery.
Oh, that's still out there.
Yeah.
It's not as prevalent, but because people are more educated, but that's still out there. They keep repeating the same thing over and over.
So you could tell, like, oh, that guy did her
There
nose.
was a guy who did Dr. Diamond, God rest his soul. I think he's probably dead, but he did all the rhinoplasties or nose jobs in New York, and every single woman's nose looked the same, to the point that when they would come in our office, I would say, "Did Dr. Diamond do your nose?" Because they were a little older, and they're like, "How'd you know that?"
Because they look the same.
They all look the same.
Yeah. So, that's, again, we don't look at people like wanting them to make their nose look a certain way. We want to fix what they don't like about something within reason and make it the best it can be.
Right. And in that case, beauty, in a sense, is derived from you. You are beautiful. How do we allow your beauty? I know this is going to sound like some Allergan Botox commercial. How are we going to let your beauty escape, right? and be more obvious or come out? How are we going to catch your beauty? And
butterfly net.
The idea is, if you think about what we think is beautiful or not, I mean, some people have this gift, but what we think about as beautiful or not comes down to these small little shades of differences. And Amy's going to talk about that.
Ooh, I love my slide. It says beautiful DNA, ? Birth order advantage, ? What birth order are you, Dr. Martin?
Whatever birth order makes me the most beautiful, that's what I am. I'm the youngest.
You're the youngest, and you are the only boy. I'm the middle child, and I'm the only girl. Nils, what are you?
Same.
Youngest and the only boy. So this is where I get to geek out. So I love epigenetics, and I'm a nutritional therapist. And one of the things that's so cool about nutrition is that if you really dig deep, you kind of go back in time to when things were very basic in our world, and people were very concerned with making sure that their offspring was top quality, meaning they would spend a lot of time making sure that people, before they even got married, were eating an extremely specific diet so that their offspring would have the best genetic advantage. These are things that have been known for hundreds of years that we in our culture now have somehow kind of forgotten that matters. We all kind of think that science can just produce a baby, when in fact, you have control over some of those things. And that's a really cool thing. So I have some pictures.
Can I say something real quick? Just
Yes.
side point in this. In the future, and I know you hate these conversations, but it will happen. They will take stem cells, make eggs. You don't even get the woman's eggs. And they will take sperm, and they will basically make 100 different impregnated eggs. And then they will sequence that DNA and pick the best parts out. And that's not just intelligence and athleticism. It's going to be what we consider beauty.
Right. That's called Gattaca.
I know.
Watch it. What was that, 1996,
Which is a
97?
major problem, because some of these, as we've denoted with Owen Wilson, some of these people that you maybe wouldn't consider beautiful are actually beautiful. And you get this homogeneous layer where the diversity is where beauty comes from. If you look in nature, any scientific environment, any environment where you can apply science, diversity is where things succeed. And that's true in beauty too. So, sorry.
It is, but you actually, getting a little deeper, darker into that.
Oh, here we go. Everyone just sit down, take your antidepressant. Here we go.
No, if you think back to, the olden times, the cave people days, or hunter-gatherer times, I'll say, you didn't have a lot to go on, right? Your time to reproduce was relatively short. Our lifespan was not as long. So what did you go on? You went on some of those things that are untangible. You would look at a prospective mate. How do they look? How do they walk?
Of course.
How does their skin look?
That's all of nature. I mean, that's Darwinianism. Darwin described that the female, or whatever, the mate, prefers someone with a stronger physical advantage, and beauty and looks are a big part of that. We're hardwired for that.
That's what I mean, that they're protective. Women were essentially protecting their own DNA from being not viable. So if you look at a couple of people out there on, in your dating pool at the time, you're going to go for the one who has bright eyes, who has thick hair, who has good skin, who's walking up really straight and upright, you know, who has good muscular tone. Those are the things you're going to look at. If they got some weird lazy eye, you're going to move on, like next, you know, because you don't want your offspring to have that trait. So we were selective in that sense because we wanted to produce better offspring. And that's true. So,
and we're selected mentally speaking, like we're set that way. I'm sure, I didn't do the research, I'm sure there's studies from a sociology standpoint, the way we pick people out from beauty relates to these certain measurements that relate to better health, right? Like
Absolutely.
To stronger, better health, or for a female to be able to rear children.
Right. And from a, you know, base level, what are we doing in that sense? We're kind of deselecting less desirable traits out of our genetic pool.
Right.
So in a sense, we were
we are Gattaca.
Right. We were kind of doing that. But you're right. I mean, that's why that desire exists, because that is built into our innate desire and need to reproduce. We're trying to get the best genetics we can. And so the idea of Gattaca, right? That's the panacea of this. Like, you can actually select every single trait that you pass on. Now, do you end up making a very, very homogeneous genome? Yeah. Are they the best? Depends on who's picking, probably, right?
Every sci-fi movie about the future is that being homogenous leads to some viral outbreak and everyone turns into zombies. So I don't want that.
So maybe it's not good. You know, something else to consider too, and that's why I say the birth order advantage, and that I have some pictures to kind of show this. How close you are in age to the sibling ahead of you is definitely going to play a role in how much of really good genetics you got and how much really good nutrition you received.
So what is how does that work?
It's not a set time. It's really more about your mother's nutrition, how she is kind of stockpiled, nutritionally speaking, going into her pregnancies is what makes the biggest difference. But if you are right away, you know, if you have a very close birth order, your chances of having the mother be fully recovered from the pregnancy before you are lower.
So all the Catholics from the 50s are out who had like 13 kids.
All the Irish twins.
Yeah.
Well, not necessarily. Again, that goes back to what they were eating. You could have a very healthful diet, recover from your pregnancy nutritionally speaking in a year, and be ready to reproduce again. The opposite could also be true. You could be very depleted going into pregnancy, come out of pregnancy even more depleted, go on a restrictive diet, try and diet back to your pre-baby weight. Now you're skinny, you're depleted. 5 years later, you're still there. You've rebuilt nothing, and now you're having another pregnancy. That child might as well have been born right up next to the other one from a nutritional standpoint, from a nutritional status standpoint. So one interesting thing, and this is where you get really deep into...
I don't think any of my parents did all this stuff. So how did I turn out so beautiful, Amy?
This is what I'm getting at.
Okay.
So
I know,
that's why I asked like where you are boy, girl, because that makes a difference. Boys who are born right after a girl, like really close, and this is through like looking at thousands and thousands of pictures, you see more feminine traits in them because there's more estrogen in their mother's body at that point in time. So that's why you're so beautiful. You got some extra estrogen.
No. I'm 5 years from my sister. That's why I'm so masculine.
Yes.
Amy.
Oh no, you're super masculine, but you're also pretty.
Okay.
That's how you're so good looking. But you can, I mean, I could talk for hours and hours on this because I find it super fascinating. And these things have been well studied over hundreds of years because if you go back.
So we, you know, the cosmetic surgeon looks at beauty as kind of skin deep, right? I mean, down to the bone. But beauty actually goes even further than that into our DNA.
The nutritional therapist looks at your beauty as what's in your genetic code.
So this mystical nature of beauty is just not that it's mystical, it's just very complicated.
It is. And
I know that at the end of this talk, the episode, all the people that clicked on this episode, they're like, okay, fine, he's going to lay out what's beautiful or not. And the answer is really there's no definition. But
Amy wants to know what your mom ate, and that's why you're not pretty.
Yeah.
So pictures of celebrity
So Amy
siblings.
is now showing Brad Pitt and another guy who looks like an uglier Brad Pitt.
That is Brad Pitt's brother, Doug, who I'm sure everyone knows about.
I mean, not only is he not
Doug
as good looking
Pitt.
as Brad, his name is Doug.
Doug Pitt.
And we got some Dougs in our life. We love Dougs, but it's not like a fancy name.
But what's great about this picture is you see the similarities, but then you also kind of start to see what makes them subtly
So if you look at this picture
less
on our
attractive.
YouTube channel, Jason Martin MD, you can see that Brad Pitt has a more prominent chin. He has a little bit more fuller cheeks. He has a longer face. If you see people in Hollywood, they have big faces, and some of that.
Big head. Was that Entourage episode?
Yeah.
Where Turtle's theory about all famous people
They do. It's
have
true.
big heads.
It's true. Like if you look at Arnold Schwarzenegger and
Big head.
they're all short with huge heads.
Your son.
And-
He's not short anymore.
well,
but
that's
man,
called frontal bossing. That's a craniofacial problem.
Kid has
That's
the biggest head ever.
Um,
You got a pretty big
and my
head.
wife said, "What are you going to do about that?" I'm like, "Well, we can operate on them, but
Put him in the helmet.
yeah." So So obviously for Hollywood people that are on camera, having a bigger head it lends better to just looking better on screen. But definitely, he just has a bigger face all the way around.
Yep. And like it's narrower,
Yeah.
a little bit longer. His shoulders are broader.
His
He's
shoulders
taller.
are broader. He's taller. He just has a more healthy look to him.
Yeah.
His eyebrows are in a better shape. His hair is not receding like his brother. And his poor Doug.
Right?
I would so hate to be.
Brad Pitt's brother.
Oh my God.
Yes.
I hate sitting next to you when we're in a consult. They're like, "You guys are so great looking." I'm like, "Yeah, you mean the Amy?"
Okay.
Whoa.
Yeah. Look at this. Here's Penelope Cruz. And
So she's not showing Penelope Cruz and someone who looks like a less pretty Penelope Cruz.
right. And this is kind of the opposite. And that's why I like these two pictures, because Brad Pitt looks better because his face is narrower and taller, whereas Penelope Cruz looks a little more beautiful because her face is a little more spread out. She has a little bit more round, wider appearing face.
Yeah, she has a good jawline. She has good cheekbones. Her nose, she has a really nice nose. Like her sister's nose, I bet you Penelope Cruz had a rhinoplasty. I put money on it.
I mean, it's
Because her sister's nose.
there's a good argument there in this
Right.
picture.
So let's assume Penelope Cruz is Spanish, right? Argentinian, Brazilian?
She's Latin American of some sort.
No, or Spanish. I think she's Spanish.
Gorgeous skin.
Well, she's beautiful.
Like
So
Portuguese, just beautiful.
Portuguese. Okay, let's go with Portuguese.
Yeah.
Everyone agree?
Portuguese.
Okay, that's
yeah.
good. So we will. Her sister obviously has a little more of an ethnic nose, and Penelope Cruz has definitely more of a
Button nose.
button nose. But you can see Penelope Cruz's eyebrows are in a little bit better shape. Her lips are a little bit better.
Mm-hmm. Well, just
That's
her mid
crazy.
face is a little bit wider.
That's
like
crazy.
overall, like even
Yeah.
if those other things, even if they had the same nose, her mid face is just a little bit wider, like a little bit more pleasing. Her head is a little bit shorter,
But
essentially.
unlike Doug
Doug Pitt.
Penelope Cruz's sister is actually very beautiful also.
yeah,
It's
she's
just
gorgeous.
Penelope Cruz is a little more beautiful than her sister.
She's Spanish.
She's Spanish.
I called it.
Okay.
I called it.
Well, here's
Amy was trying to say Portuguese. Is like, whatever.
one for the OGs.
Oh my
Oh,
gosh.
Sean Connery.
Who's the other guy? Is that?
That's his brother.
Are you kidding me?
I am not kidding you.
So she's now showing a picture of Sean Connery and his brother, who looks like. It's very interesting.
Right? Almost like a clown version of Sean Connery.
It's almost like you took. Yeah, it's like you put Sean Connery in a Mad magazine. Do you know what I'm saying?
Yes.
And gave his like caricature
Unfold
person.
him,
Yeah.
yeah.
Wow.
Yeah. And again, I mean, we see kind of the same
I mean, he's a
things,
good-looking
like-
guy. I mean, don't get me wrong, but
Yeah.
he doesn't have that Sean Connery stuff. And it's
No.
not like Sean Connery's so attractive. There's something about that dude that makes
Oh,
you
Sean Connery is so attractive.
like he has that, and maybe it's
Mm-hmm.
the voice. And by the way, we didn't talk about that. Like I mentioned at the beginning, beauty is also in presentation.
Yes.
I've come in to the office, and someone walks through the door, and they have some flowing, colorful dress, and they exude personality, and you're like, I love this person. Like, this is great, right? Like some of that's there. Sean
Yes.
Connery has that, whatever
Oh, yeah,
that
he's
is.
got that. He's got swagger.
Swag, yeah.
Yep. So does Brad Pitt. I mean, I would not say that Doug Pitt has swagger.
I mean, what?
He's goofy.
I know what happened if Doug Pitt was like the coolest dude ever.
Oh, he
though,
might
you know?
be, but I mean,
Just because he's like, I mean, he's really funny and self-deprecating, and he's like, can you believe Brad Pitt's my brother? He'd be the best at a dinner party.
Right.
He goes, when we were 12, and he was like starring in whatever role. Yeah, that's crazy.
Mm-hmm.
So you can really see that even though they're siblings and they really come from the same genetic pool, just little changes, aesthetically speaking, can change someone from really beautiful to, good looking, normal. And it's not drastic. Brad Pitt and his brother is you should look on the internet and that you can see how the beauty changes just with subtle changes in the anatomy. But this is the question I have, and this is kind of what I've been struggling with. Is it because we already accept Brad Pitt as beautiful?
right. And same thing with Penelope Cruz.
Right. What if this was a different universe and Doug Pitt was the good-looking one.
Yeah.
And Brad Pitt was like, oh my God, this guy's trash.
Well, and that, that is so true, because beauty is situational, yes, but at the same time, our perception of beauty is going to be altered by our age, the age of the person we're looking at. I mean, you look at a teeny bopper heartthrob right now, and like, I'm not going to think that person is beautiful. I might think that they're cute. Am I going to say that there's true beauty there? Probably not. Whereas I can look at this picture of Sean Connery when he was like 80 and be like, oh my gosh, like that is a sexy man.
Right. And that gets into a cultural thing, because like you brought teeny boppers. I was thinking about this, like the K-pop, like the Korean movement, pop movement. They all get plastic surgery when they're really young. All of them. All those females do. And they all get
the males do too.
I don't know about that. But they get westernized eyelids, so they get a crease put basically in their upper eyelids. They get rhinoplasties or nose job. They get their jawline shaved down to more of a pointed chin, which is kind of disturbing, but that's what they revere in their culture as beautiful. And it's not like you look at them and say, "Oh, they are beautiful," even when they look like that. But that's a little bit concerning that they're coming from a cosmetic surgeon, that they're changing their cultural look to look more westernized. So there is an element of this that really involves the cultural stuff. I mean, obviously, Brad Pitt may not be good looking in China or something. I don't know.
Yeah, and
Brad Pitt's probably good looking everywhere. That guy goes everywhere. This is like, I remember we went to Lake Como, and I remember being.
Were you hanging out with Brad Pitt and
no,
George Clooney?
George Clooney. And I remember going to like this, like we didn't eat there, but went to this really area, where this really nice restaurant was, and it was a lake, and the water taxi would come up. It's called Villa d'Este. It's a 5-star Michelin rated restaurant, and you could just imagine George Clooney, and what's his wife's name? Amal, getting off the boat, going to this place in a tuxedo. I'm like, there's all of us. It doesn't matter how nice of a tuxedo you have on. It doesn't matter how many people do your hair and makeup. There's no way you could even get off the boat like he could at a place like this and just stroll out and be like, I'm awesome.
It's the swagger.
So he could pull it off in China. But I think, there's a cultural component to this too. It gets very complicated. Remember what Potter Stewart said, I know it when I see it. And that is really what beauty is all about. And that's the fact, because everyone knows that couple where they don't fit. And one of them is beautiful.
Or somebody's married
and it's
up.
usually the woman. And the man is not. And everyone says, well, that's money. It's not always money, right? It's just, and they find each other beautiful. And they have a great relationship.
Yeah, and I think...
There goes your epigenetics. We don't need you anymore.
Well,
Your
no, actually, that's
world.
where you do need the epigenetics. That's where someone may not be like drop dead gorgeous, but maybe they have amazing bone structure. Maybe they can like kill a bear with their bare hands.
Right, and that is the weird part about selecting a mate, because even though they may not be beautiful, the combination of your genetics with their genetics randomly put together may pump out a Brad Pitt.
Right.
Or it may pump out a Doug Pitt.
Or both. You want them each? Yes. I mean, that to me, if someone asked me, like, what makes someone beautiful, the last thing I would talk about is how they look.
Right, and I feel the same way, and that's crazy because we're basically
we work in beauty.
Very successful cosmetic surgery office.
But I think that actually speaks to why, because we aren't looking at a person as flawed or broken or weird when they come in. Like, we're willing to listen to what they say about what they want to change, and that's great, because we aren't, like, I just don't judge a person by the look of them.
We in our practice approach everyone that has a value, and you're really trying to enhance what they already have, what is God or nature given. That's kind of the way we do it.
Yeah.
It's that simple. And people always ask, well, how do you know what to do? Well, I know what to do because, for at least me personally, I was a fine arts major. I look at people creatively. I see things that, wow, that really has value there. That it's beautiful. That's this component of their face, their jawline or their cheek. How can I enhance around that? How can I make that more evident? Like we talked about with the brow lift. The brow is kind of a frame for the picture, your eye, which is the picture. How do you make that frame the eye better, right? Stuff like that. Also, for those listening to this episode and they don't feel beautiful, I can find beauty in everyone's face. There is something on every single person comes in, and that's true even for someone who's been traumatically injured. You can find that has beauty to it. And we do reconstructive surgery because it helps me as a surgeon. It helps me do better cosmetic surgery of the face because you learn anatomy better. You learn to deal with difficult problems, and you can translate that to cosmetic surgery. But even our trauma patients, you can find beauty in those situations too. So, and that does help your brain, right? Because if you see someone who's been traumatized for an assault or a fire or whatever, then it does change your definition of beauty a little bit. Like life experiences do.
Yeah. Well, and for that person who's suffered the trauma as well, you might not ever look quite the same, but being able to look at yourself and see yourself again is pretty amazing. And the same goes for cosmetic surgery. We age subtly. So it's not like you wake up one day and you look 30 years older.
Everyone comes in and says that.
Well, they do because
I woke up last week and I was like, oh my God, look at my face. What
happened?
And I was like, oh, so you look totally normal before a week ago?
Yeah.
I just want to get this straight. And everyone says that.
They do because you don't see those small changes that happen over time. You really don't. It's not until you.
I mean, I do, but
that's because that's what we do.
Sickness.
I mean, so do I. I see it every single day. It's like when people ask me if I'm a facelift, I'm like, I'm looking in the mirror every single day, and they're like, "Well, you're too young." I'm like, "Not really," but I know the future. Yeah. Unlike all of you blissfully happy people, until the day you get your facelift.
Ignorance is
seriously
bliss.
enjoy that time of feeling like you haven't aged.
I'm gonna look 35 for the rest of my life.
Yes, good luck with that,
America.
but that's being able to help someone see themselves again in the mirror is a pretty amazing thing. And whether that's from a traumatic injury or just helping them, feel like they are presenting the face that they feel like they should see in the mirror and aren't, getting that back to somebody is a really powerful thing.
So we can just give people some food for thought, and so they won't say that we just ripped them off because we didn't tell them what's beautiful. Just so you know, when it comes to aesthetics, there are things that we find, or at least as a cosmetic surgeon, that we find beautiful. Usually it's a little longer forehead, but not too long. Amy has a forehead that's like, could put a billboard on it.
I got like a 12 head. Yeah. It's more than 4, it's 8.
Your eyebrows lie at or above your orbital rim, or the bone that you feel up there, and they curve upward and outward. You have a crease or well-defined upper eyelid. If you're Asian, you don't have a crease there, so that would be obviously acceptable for beauty if you don't have a crease. Your lower eyelids are well-defined. Your eyes are open, but have a nice almond shape, not a round-eyed shape that you get with surgery. You have defined cheekbones with some softening from fat. Now, there are people out there that have really strong cheekbones, and that looks, in my mind, looks a little bit better in women than men. But if it gets too defined, too sharp, that can be a little bit angular and harsh. It doesn't seem beautiful. Your lips are full, not too full, Kardashians, okay, full enough, and both the uppers and lowers, and they kind of both show. Your teeth are well aligned, and you have a nice smile and not too gummy. Your jawline is well defined, and preferably for for women and men, the jawline is prominent. Your chin is defined too. It's not too far out or in. We talked about the cephalometric analysis. We really look at the chin in that situation, and then your neck is softer but defined. So these are kind of the things that we look at, and then we look at the proportions too. So there you go. That's a beautiful face. You take that and tell all your friends that's what I said. But in the end, you can have someone with a long forehead and a short chin, and you can look at them, they're beautiful.
That's right. Yeah. So my take on that is, if you're a person out there, you are beautiful. I think you're beautiful. Every person listening.
Anyone who ranked and rated our podcast is beautiful.
Yep.
Anyone who did not is not beautiful at all.
No, you're beautiful too. Like, play that over if anyone needs
that. And follow
that.
us on Instagram.
Play that over and
Jason
over
Martin,
again.
MD.
I think you're beautiful.
Okay. Any last words of wisdom, Amy?
No, but if you guys want to hear me talk more about DNA and beauty, just leave us a comment. If you never want me to talk about it again.
Yeah, we actually welcome comments. We've had some good comments lately. We have some episodes coming up that we're going to actually talk about some of the comments that people suggested. So that's great. We have, we've noted it multiple times, but we do have a YouTube channel, Jason Martin MD. Please go on and what do you call it? Subscribe?
I would call it subscribe.
Okay.
Hit that notification bell. Get notified every time we drop a new video.
We are on Instagram specifically for this podcast.
At Beauty and the Surgeon Podcast.
We are also on Twitter, but Amy hates Twitter, so we're not going to mention it. It's kind of the word we don't say in our office.
We're sort of on Twitter.
We're kind of on Twitter. Are we half and half on Twitter?
I mean,
We're kind of 1 foot in, 1 foot out.
We're
Swiping left now,
yeah,
right?
We're
Or however that works.
No, like we're kind of ghosting Twitter.
We're kind of ghosting
right,
Twitter.
we're there, but
Facebook kind of annoys us a little bit too, but we are on there. And we loved your interactions. We love doing this podcast. It's been great. Our analytics have continued to improve over the past year. And to be honest with you, we've done so many topics that now we have the freedom to actually do fun, even topics that are different, like the one we just did, which is great. Like what makes a face beautiful. So if you have a different idea of beauty, you can write and email us. Don't email me because I won't look at it, but you can email amy@jasonmartinmd, and we'd love to interact with you on what you think or you don't think is beautiful. What else you got to add to this, Amy?
that's it. I think you're beautiful.
I think you are beautiful. I think Nils is beautiful. Nils'
Sarah's
wife,
beautiful.
Sarah, is beautiful.
Oh,
my
goodness.
wife, Barbara, is beautiful.
She is gorgeous.
Yeah.
She's more than beautiful.
We're surrounded by such beauty.
We are. It's all around.
It's hard being so beautiful. Okay.
Thank you so much.
Thank you.